Welcome to another show. What if I tell you that you could fix your night cramps with just a spoon of a very interesting liquid that you probably have in your fridge right now? We'll discuss that today. My name is Jesus Vega. I'm a physician. I'm covering for Dr. Brewer in today's show, and today is about leg cramps. There are multiple causes for leg cramps, but one of the most common ones is just having those muscle contractions right in your calves that are not letting you sleep properly. So today I'm going to show you how one spoon of a specific liquid can help you with that. It is backed by science. When I read this the first time, I was like, this cannot be true. But actually, the science is pretty strong on this one. And after that, we're going to discuss other causes of leg cramps that you might need to know. I'm going to walk you through some of the specific symptoms and differences between leg cramps so you can identify what's probably the major cause of leg cramps in your case and what to do about it other than this specific quote unquote magic fix. And after that, we're going to go to the usual Q&A. This is a live show, so it's going to take a while. But let's get the cat out of the bag. So there's one specific liquid that you can take at night, just one spoon, maybe two spoons. That's going to help with the problem with leg cramps. And I'm holding it right here. So I'm going to put it on the camera. Let's see if you can watch it. There. You tell me what that looks like. Those are pickles. So pickle juice full with vinegar does something very interesting in terms of fixing leg cramps, especially at night. When you have a leg cramp, there are specific neurons, nerves that go into your muscle and they're usually overactivated. They're sending messages to the muscle to contract. And when the muscle contracts when you don't want it to do it, that's when you get a leg cramp. And it's painful and it's hard to get rid of. You massage it, you do whatever you can to ease that muscle contraction, and it's so hard to fix it. So, what happens with the vinegar and pickle juice? Something really interesting. So, you go ahead and take that 1 tablespoon of pickle juice, maybe two, put it then in your mouth, and then drink it. The strong flavor and chemicals on vinegar will stimulate nerve endings on your mouth, your throat, and what we call the oropharynx, which is above the throat and behind your tongue. And when you stimulate that, you're sending a specific nerve signals that go into your brainstem, your spinal cord, and you start producing a reflex. That reflex is saying, hey, there is such an intense response here. That's something that's coming abroad. Let's ease down all of our nervous system. And when you go into that reflex, this is what we call a sensory motor reflex. This sensitive stimuli is producing that effect on your mouth, your throat, and your oropharynx, the back of your mouth, and sending that to your spinal cord into some of the cranial nerves, then, which are the ninth and the 10th. The ninth is the glossopharyngeal cranial nerve, which is a nerve that goes around your tongue and the back of your mouth, the oropharynx, yet again, that tricky word, and then the vagus nerve. And the vagus nerve goes all around the place, all over your body, basically. So when you create that effect, goes into your muscles and reduces the responses that are coming from your motor neurons. Your motor neurons are basically the nerves that go into your muscles and create that muscle contraction. And that's what it was proven in a 2010 research paper, which was done in athletes that had problems with hydration specifically. So they're having low potassium, hydration issues, muscles contract too hard. They drink a tablespoon of pickle juice, and interestingly, the effect is surprisingly quick. You get rid of those muscle cramps in less than 2 minutes. So nothing necessarily magical here. It's just pure science. Pickle juice. You have it there. Let me see if I can get it there on the screen again. I love them. This is not a metabolic response though. The salt on the pickle juice, the other stuff that it might be in there, it doesn't act that fast. It has to go to the gut and then absorb. This is a nerve response reflex, which is going to get rid of those cramps. If your problem has to do with dehydration and the muscle cramping, that's the tricky part in here. Now, why I am mentioning that part, because you cannot expect that pickle juice is going to solve everything for everybody. That's the second part that I wanted to show you today in this show, which is this chart over here that I prepared for you guys. So not all cramps are necessarily the same. And let me see if I can get myself a little bit here. Yeah. So not all cramps are necessarily the same. Certain cramps will appear in different times of the day, will have different circumstances around them. And sometimes you go to the doctor and you just tell them, hey, I'm dealing with leg cramps. What can I do? And the immediate response, well, okay, this is maybe low potassium, or this is diabetes related, which is the number one cause. But even at home, you can try to identify and make your own differential analysis and say, okay, which one of these factors is affecting me the most that is producing those leg cramps in my case? So, if the leg cramps are happening after you exercise, you're sweating, you're exposed to heat, you're having a lot of diarrhea, you're not drinking enough electrolytes, and the cramps are involving your calves, your thighs, or your feet, this is likely an electrolyte issue. And you're going to have ready some electrolytes fluid. Some people use some uh, potassium tablets, potassium and magnesium tablets that can help. But if the cramps are happening in this specific situation, this might be the problem. Second situation, second characteristic for leg cramps. And you can take a quick screenshot of this. This might be helping you to identify this. If the cramps are starting within weeks or months, or they start with a new medication, you didn't change your diet, your activity, your exercise, and they often worse at night, you need to take a look at your medication list. One of the three of the major culprits of cramps regarding medications are diuretics, specifically Lasix, which produces you to lose potassium on your urine, statins, which we have had multiple shows in regards to statins and how much this happens, and beta blockers like metoprolol. So some of these mechanisms are not necessarily clear. Some of them have still things going around them. Some of them have to do with the electrolyte balance as well. But whenever you have new medications coming in and you have some side effects, it's important to discuss with whoever prescribed them. Third situation for leg cramps. They're triggered by walking and they are relieved when you rest. That's what we call claudication. And they can happen at night. So your legs might feel cold, have weak pulses, and if you put them high, they can worsen the pain a little bit. And sometimes just shaking them or moving around can help a little bit with the pain. If you're losing your hair in your legs, you used to have hair in your legs, you're losing some of that, or your skin just doesn't look as hydrated and moisture as it usually is, and it's more dry. That's very like a poor circulation issue, what we call peripheral artery disease. If you start having problems with the sensitivity on your toes or on the bottom of your feet, that also can be a nerve issue situation. And both of them can be associated with, you know it, if you're following this channel for a while, prediabetes and diabetes. And the next situation is what happens if you have leg cramps late day or overnight, especially after heat exposure similar to the first one, but you also have dry mouth, dizziness, or even dark urine, which is something really severe. And the cramps improve with fluids and electrolytes. So you can have a mixture of both. You can have some potassium and magnesium loss, or you can also have some fluid, just liquid water loss, and that's important also to figure out. And what happens if they happen in the middle of the night, early morning, and it's usually just one muscle group, can be your calf or your arc, and these are usually related to whenever you're putting your toes, like pointing. You have to stretch your toes like that when you're sleeping, or long sitting periods. And stretching can actually reduce it. And this is more like a muscle fatigue and muscle issue specifically that can be improved with pickle juice. Some other studies have analyzed specific stretching exercise and routines, exercise before bedtime, which can also help if this is the specific problem. But the thing is, we need to take a look at what are the details happening in your specific case, so you can have a more clear idea what could be possibly the culprit. And sometimes it's not just one of them. Sometimes it's multiple causes that are causing those leg cramps, and they can be really really challenging. So what can you do? So in this chart, I'm showing you some quick tips that you can actually implement in some of those. Some might seem very obvious, and some might require some help. So for the electrolyte imbalances, just electrolyte fluids, of course. But if you're adding into your diet rich potassium and magnesium foods like leafy greens, nuts, some specific seeds, not seed oil, some specific seeds, and some beans, if you're not raising your blood sugar, or low sugar electrolyte drinks, that's something that you could consider. Discussing your medications and side effects. We have had people that just cannot tolerate statins because of that. I had a patient that had kidney disease. So sodium balance, potassium balance, and somebody who has kidney disease is very important. You got to be careful with whatever supplementation you do with potassium if you've had kidney issues. And this person was into a lot of diuretics, and actually was dealing with not just leg cramps but severe dehydration and worsening of kidney failure. You got to be very careful whenever you're dealing with those medications, and not just changing them on your own. It's something you need to discuss. Hopefully with a provider who's willing to listen, right? Poor circulation, nerve issues, exercise on this one is critical. If you are having not just cramps and pain, but swelling, using compression socks is really, really important. Sometimes we don't give it the necessarily praise or emphasis on using compression socks for somebody who's dealing with deep venous thrombosis, or just swelling on their feet, on legs. Addressing PID, peripheral artery disease, and neuropathy, which, if you have followed the channel before, we are all about prevention and lifestyle. And peripheral artery disease is kind of a late stage situation on arterial plaque issues. So it requires a lot of effort changing the lifestyle, and sometimes some medication support in that case. And neuropathy is kind of the same way. You cannot expect to have improvement on neuropathy and nerve damage caused by prediabetes or diabetes if you don't change the way you eat and the way you exercise first. Sometimes you have to go and endure through the pain while to get to the best results, right? Dehydration, just drinking more fluids. Here we are adding some fruits. I know fruits have two things: sometimes glucose, sometimes a lot of fructose. There are some low glycemic fruits that you can try, like berries, strawberries, even, I don't know, technically a fruit, maybe the pickles might be technically a fruit that will have a bunch of electrolytes, a bunch of fluids with them. And just if you do some bone broths, and some other types of soups that are not too loaded with sugar, and just keeping yourself hydrated, avoiding late night hydration though. A lot of fluids on night, especially for older men who are dealing with prostate issues, is going to be a bad combo. And for muscle fatigue and shortening, we're talking about stretching your calves, hamstring before you go to bedtime, and doing some ankle movements in your bed, and avoiding heavy blankets or pillows that will probably push your feet, so you're kind of stretching your toes, pointing your toes up to the front. So if you're pushing your calves too much um, while sleeping, that can be another problem. Um, there are other solutions like heat pads and some hot ointments that have a substance called capsaicin. We discussed capsaicin in one of our members only videos. Somebody talking about cayenne pepper, and capsaicin is something that is in cayenne pepper. And there are some ointments that work in a similar way as we discussed with the vinegar, but it's like a topical stimuli for the nerve ending sensors uh, in your legs. So it's kind of a more localized thing. Can work, may not work. It's a little bit more. This you can discuss and have more conversations in that regard, how effective that is. But that's another option that's out there, right? So this is kind of a short, sweet 15-minute discussion on leg cramps. There are other causes of leg cramps that we didn't discuss that are not necessarily that common. But you just let me know what do you think about these ones, and if you have dealing with those and you're doing something different, share with us what has worked for you. That will be very interesting to read. Um, Before we go to the Q&A, I just want to remind you, Dr. Brewer is not around. This is his channel. I'm not hijacking him. He's gonna be back next week. Um, and as somebody who has walked the talk, Dr. Brewer has taught me a lot, including some of this stuff about leg cramps. Although I'm not sure he has dealt with leg cramps other than whenever he was doing marathon. We can ask him. We can ask him next week. But if you're interested on looking for a specific service that can help you understand how to do prevention using lifestyle and avoiding heart attacks and strokes from people who have been directly trained by the man, Dr. Brewer, give us a call, 859-721-1414. We'll be happy to help you out. I'm kind of the first trainees from Dr. Brewer, learn a lot of stuff that I did wasn't taught on med school and prevention school, even though I had like a similar training like Dr. Brewer, although he went to Johns Hopkins. I didn't, so that's why he's the man. Nevertheless, if you're frustrated with the current care you're dealing with, give us a call. We might be able to help. We have different programs, and some of those might fit you. All right. So, Aspen, do we have that specific B-roll from the arteries that we can use so people know that we're going to Q&A now? Love it. Thank you so much, Aspen. Let me give a shout out to three new members. This is Samir Mahid. Thank you so much for becoming a member. It really makes a difference. You have no idea. It goes a long way. Imad Akhtar, I hope I pronounced that correctly, and May V. Eh, That's an interesting name. Okay, well, thank you so much for becoming members. And if you haven't become a member, uh, click on the subscribe button, and next to it, it should be a button that says join, or you can have the subscribe plus button, whatever those two options you might be. And if you become a member of the channel, I will answer your questions first, as well as Dr. Brewer. And we also have some specific members only content that we are putting out there as a show of appreciation more than anything else. And if you haven't become a member, that's fine. Just by watching the channel and following us over here, that makes a huge, huge difference. Thank you so much. So let's see how many questions we can answer today. This might be a short show today, guys. Um, let's go ahead and take a look at this. JMK, do you think that statin therapy might contribute to leg cramps at night? Yes, definitely. We just mentioned that as one of the options. Is that the main cause? I don't think so. I think there are plenty of other causes like prediabetes, diabetes, and electrolyte issues, and not stretching enough when exercising, and there's a lot of other stuff. But definitely, statins is right there. I don't see many members' questions. I'm just gonna go in order. I think we're gonna be able to solve most of these questions today. Leo Acapulco, pickle juice, yes, pickle juice, yum, yum indeed. Uh, Miller Woodward, good morning from Florida. Good morning. Uh, H bounce, I need to fix this. Yes, I can even imagine. Like I personally haven't dealt with night cramps, so I'm just too. I don't want to say too young to start dealing with that. I have had that issues, especially when I do exercise a lot. So, and it's just the stretching part and the fluids and replacement, which is very, very common. But I can even imagine how it would be to having the leg cramps every single night. So I agree, it's something that needs to be taken care of. Um, Josie 808. Dr. Brewer has some interesting product. However, when I go to the supplements page, it doesn't list what's on the bottle's label. Yeah, we're trying to fix specifically how we present that. So if you click on the image of the bottle, you'll have multiple images. and some of those images will list all the items in there. But I'm gonna make sure that whoever is in charge of that knows about this, so you can also have the list of ingredients on those supplements next in a written form that you can read it as well. Uh, Joe Salevi, is pitavastatin better than other statins in preventing leg cramps? That's an interesting question. I will need to go back to the research and see which statin is probably less has less side effects. I'll argue pitavastatin is probably one of them. What we have seen in research in regards to statins and leg cramps, though, is that it's not just the type of statin, which of course matters, it's the dosing. So the higher the dose, the higher the chances of dealing with side effects. So that's kind of the key question. But yes, if there are two statins Dr. Brewer recommends and low dose for whoever has arterial plaque and that might have less incidence of side effects are rosuvastatin and pitavastatin. Pitavastatin. So, but we still see some cases even with low doses. So as we say, it's not mandatory to take a statin. It's not like everybody needs a statin, but for some who do, just taking care of that will be important. Uh, Sometimes you just need to stop it and try something different. The Anderson, I take a supplement with all the max, never sore whatsoever. Fantastic. Yes, magnesium. Magnesium is like, I know you guys know this because you are in the like very deep into this geeky stuff. Magnesium is one of those one of the most prevalent, most common electrolyte deficiencies out there. Like over 50% of the population have some level of magnesium deficiency. Millard Woods, I bought the creatine powder, great price and high quality. Thank you so much. I hope you're getting the benefits. Somebody, I wanna make sure to address this. Somebody said that they supplement with creatine have some leg cramps. I have only seen one person reporting this, um, but I haven't seen enough on the literature to say that happens. So whenever you're testing a new supplement, new medication, take a look at any side effects. That's important to know. JC808, I keep away from prescriptions as much as possible. Yeah, I mean, it makes sense. In the words of, I believe, who's the first person to say this? Oh man, I'm blanking on the name. There's somebody who says that if you're healthy enough, you don't need medications. Only sick people need medications. They say it better than I do. But the point is, if you're able to keep a healthy lifestyle and manage your health, uh, most likely you're not going to require medications. But this is what happens, and this is what we see all the time. This knowledge is usually not either available or interesting enough for the young crowd. When you're in your 20s and 30s, you don't really care about this. You don't really care about getting old. You don't really expect that you're going to be dealing with like cramps at night and developing arterial plaque or die from a heart attack. So you don't really care. And since you don't care that much, you are abusing your body even when starting as a teenager, just based on whatever you're fed and the way you exercise up until you get into your 30s and 40s. And then here comes a moment of realization where you say, hey, I probably should be doing this better. And that's when you're trying to overcome and replace all the stuff you did previously. And sometimes in those cases, even though lifestyle will do the most benefit that you can ever imagine, even better than any medication, some patients do require the extra push of a medication, of a prescription, or at least a supplement. And that's just the way it is. Some people has to do with genetics. Some people has to do with the way they manage their life on their earlier decades before realizing they need to do a change. And Dr. Westman is the one who I have listened and have said that only those who really are sick enough need medications. Joe Salevi, I have restless leg syndrome. I suffered many years. Finally started reading magnesium glycine and B complex. It seems to have resolved the problem for now. Fantastic. Yeah. And restless leg syndrome, if you look at the literature, it has some of all those factors involved. That's why it's really important to identify which one can be the one and start fixing at least one at a time and see what happens. There's nothing to do um, that's going to just solve the problem. There's usually multiple factors involved. Wakas Kureishi, can we regrow hair loss in the front of the legs in age 65 plus? Any vitamins or exercise to increase blood flow if that's the cause of hair loss? More than any kind of vitamin of exercise, like some people will argue maybe vitamin K2. Um, I think what's most important, especially for the arteries that go into your legs and they're smaller as they go through your feet and toes, and you start losing those capillaries that grow your hair. All of those are being fed by the blood flow that's coming from those main arteries, and they get smaller, smaller, and smaller. So the smaller the artery, the more damage any plaque is going to cause that there, and the less the blood flow, that artery starts to shrink, and you start losing that artery, and that's why you start losing some of that hair on your legs. It's hard to create new vessels. I haven't seen any medication, any supplement that's going to help you really regrow those vessels. The best thing we have seen that actually regrows vessels is actually exercise. Just you can do some aerobic training, but it's usually resistance training and high intensity interval training. Pushing your boundaries, pressing your heart, pressing your arteries into requiring more blood flow, that's usually what's going to produce and promote more new vessels. Regrowing hair, it's a little bit tricky and hard to do because just like the hair that you some of the hair that you might lose on your head because of genetics and what we call alopecia, which is just those capillaries just die, and sometimes when those capillaries die, they are just gone. So to us, more than the goal is not so much like regrow the hair on your legs, it's more about identifying if you're losing that hair. That means that you need to do something about that blood flow, because hair loss is just a minor consequence in your legs. I will say, I'll assume, unless you live out of because unless you live out of taking pictures on your legs and showing your hair. But it's more about um, what happens after you're reducing blood flow in other arteries, including your heart. JMK, why don't our PCP ever present absolute risk reduction when it comes to statin or vaccines? I don't think they have all the data, necessarily data. And the one thing I will say in regards to absolute risk reduction is uh, usually the study, I reviewed that study when they did that absolute risk reduction, they usually follow for a kind of a short period of time. Some medications, and I'm going to be playing the devil's advocate here, some medications require way more time of follow-up to identify that. And you don't see that many studies that will cover 15, 20, 30 years of follow-up. That's kind of the biggest challenge in research. Um, but yeah. Doctor, yeah, I've tried everything. I'm skeptical here, but I'm listening. Laid one on me. Well, I think the first thing would be like, are your leg cramps associated with uh intense stimuli of your nerves in your muscles? If that's the case, the pickle juice might help. If it's not, it requires a deep dive onto this. And I know it can be really frustrating sometimes not finding the answer. And this is just like 15, 20 minutes show that we're covering uh, on this. Good morning, Angie Lapointe. Joycey 808. Dr. Brewer says that if there is no leg hair, it means the blood vessels that fed the hair growth are all congested. They can be all congested for sure. I agree 100%. Uh, but remember, if the blood vessel is congested, there's not enough blood flow, and a part of the body that doesn't get enough blood flow can die, depending on which one it is, and sometimes are different than others. So if you have a clogged artery on your legs that's not allowing some blood flow going to your hair capillaries, or follicles, better said, that's the right word, follicles. Uh, that can be a problem. To us, it's more like a sign of the metabolic issue that's going on with clogged arteries. Angela Pointe, I drink pickle juice all the time. I like fermented pickle juice. Yes, fantastic. Uh, JMK, do you think that pickle juice might ease up severe low back muscle spasms? That's a great question. I'm not sure. I'll as I usually like to go take a look first, and then decide before just saying yes, it will or it will not. I will argue that it might help, but the problem is back muscle spasms usually involves bigger muscles, and those bigger muscles can be harder to relax. But I'll take a look. That's an interesting application from what we just discussed today. Jesse 808, magnesium glycine works for leg cramps, but I'm gonna try the pickle juice. Yeah, but just like we said, it's different mechanisms. So if your leg cramp is caused by low hydration and low magnesium and potassium levels, magnesium is gonna work better. If your leg cramp is caused by this over muscle reaction, pickle juice might work like a quick fix. Not saying that you should do it for the rest of your life. It's about fixing immediately the issue. What about tonic water? I'll have to take a quick closer look to tonic water. I'm not sure it has the right balance of electrolytes though, and the substance it has there, I believe pronunciation is quinine. There's a specific substance in tonic water has other implications, so we don't necessarily recommend drinking too much of that. I was addicted to that thing for a while, but some people might add even some sugar in those drinks, so you gotta be careful. Miller Woods, I would like to hear a presentation on pain and the fear it can cause. Pain and the fear it can cause. Y- I would love to talk about that. I'll need more specifics, like if this is heartaches or pain in the legs or pain where. That will be interesting. And of course, I think that's an interesting topic. Talking about fear and how to manage the fear, right? Brenda Weldon. I know, Brenda, you are a new member. I've seen some of your comments. Thank you so much for joining. Leg cramps last night. I found I straighten my legs out and I can meditate out of them and fall back to sleep. Yeah, fantastic. And maybe the pickle just can help in cases like that when the stretching helps. So it's both situations. Stretching before bedtime, that's another one. And just looking at how you sleep. Sometimes we tend to sleep on some of the more awkward positions that you can even imagine. Laura Baldwin, I keep a small bottle of yellow mustard. Yes, and I take a half to a tap, gonna get ankle and calf cramps. Have a quick relief. I'm glad that you mentioned the mustard. I was hesitant to mention the mustard because I think it's way better to drink the pickle juice than mustard. But this effect has also been shown with mustard. Thank you so much for bringing it up. I just personally prefer the pickle juice, but mustard has shown to have kind of the same effect. Thank you. Is stress also a cause of night cramps of the two legs? It could be. It really could be. I sometimes feel like the stress, more than just a root cause, is kind of a major neglected risk factor involved, for sure. David Black, I use magnesium foam to ease cramps. Any thoughts? Good. Um, I don't have enough experience with those. I'll try to take a look. If the method in which this magnesium foam is able to be absorbed or ingested and it's gonna go into the bloodstream and help with them, and I'll say yes. Like the magnesium supplementation, of course, helps. Um, I take a quick lot of magnesium orally, but I don't see it to fix the problem. Yeah, yeah. Sometimes absorption of magnesium is another one. That's why, you know, uh, a bunch of different magnesium forms. Some will be get absorbed better than others, and that makes it a little bit difficult. Some people use Epsom baths, which also I think the evidence on them there's tricky. There's some good studies supporting the Epsom salt baths. Some others that are not as good. So it's sometimes it's just about trial and error as long as you're not taking too much of something. Um, Let me see. I think I have. We can go through some other questions before we leave. I think I heard the cracking sound in my legs the other day. Uh, yeah, that happens. I suffer from bad cramps. I started taking magnesium glycine at the night, and it definitely helps. Yeah, but I have to take around 500 milligrams. Wonder if it's the any issue taking so much every day. I don't really think 500 milligrams of magnesium glycinate is that much. Uh, I don't think it's kind of beyond the standard dose. Arky, I found the liquid magnesium gel to give the best protection bedtime. Fantastic. That's another option, of course. And as usual, just like we try to give you some new information, this group is very, very educated in these topics. And as I just mentioned, sometimes you need to test it yourself. And until you test it yourself, you start seeing some of those results. And I appreciate you guys sharing those with the community. At the end, if you're dealing with leg cramps, you'll try whatever as long as not it's not gonna hurt you. Just be very careful whatever you try. Don't do anything dangerous, of course. Mother words, often I don't know which pains to ignore. Chest pain, for example, can be from extra exercise, arthritis, but it's not as scary as pain that might be coming from arterial disease. Oh, okay. I understand that. Yeah. So it's like which pain can be dangerous? What are the pains that should raise a red flag? And I think we can do a show about that. Like we're a lot about prevention, but sometimes we neglect the part of okay, what happens to somebody who is like too deep into the hole, is very down the road, and even though you might be trying to do something to improve and fix these things, still, you might have a heart attack. And how do you identify if your chest pain is because of a heart attack, or is more of a stable angina, or when should I run to the ER versus when can I just have a quick call with a provider and just trying to figure out when I should be worried and versus when I can be a little bit more relaxed. Yeah, that's a great topic to discuss. Thank you for bringing it up. Harvey ups, Epsom salts, magnesium chloride, most absorbable through the skin. Yes, but again, I've seen some research and there's it's still debated. It is still debated. I'll just say that. I don't know, Veronica Schefter. This is Schefter. Great comment. When I have night cramps and I eat some chocolate, it helps. Is this coincidence? Maybe. I don't know. I'll take a look at chocolate. I haven't seen anything on chocolate reducing leg cramps. There might be something there that I'm not aware of. So I'll take a look. I want to take a look at this question. Arky 407. I have fought chronic nocturnal leg cramps since 1995. Ironically, it started about 6 to 8 months after doc put me on simvastatin. Take magnesium, quinine, sulfate, 3 to 224 milligrams, but must balance magnesium with calcium. Don't. Magnesium, calcium with magnesium and calcium as supplementing. We just did a show, a video. Dr. Brewer covered 5 supplements that senior take that can be dangerous. Calcium is one of them, just because of some evidence that has associated calcium intake with R3 disease, especially those who are just overdosing on it. So I will agree. I'll be more comfortable supplementing with magnesium than I would be supplementing with calcium. All right. Well, thank you so much for staying with us. I hope we don't have enough background noise. Uh, don't miss our show for this Saturday. We're going to talk about foods that raise blood sugar dangerously and that you might not be even aware that you're eating them. We'll be seeing you in the next YouTube Live next Thursday. So thank you so much for joining us. Oh, don't forget, 859-721-1414 if you're tired of your current medical care, you want to have a second opinion. We have a group of clinical advisors that will be happy to help you directly train with Dr. Brewer, or you can see some of the programs and packages we have available. Call 859-721-1414. Visit prepmedhealth.com. Or there's one more thing that I neglected to mention. I hope you're able to see that. We have a specific 7-step protocol Dr. Brewer developed to prevent heart attacks and strokes. We built that PDF. It's on the description, and I'm going to put some of that on the pinned comment as well for you to take a look at it. We're still cleaning it up a little bit, but uh, the main knowledge and Dr. Brewer's experiences in that ebook. So take a look at it. We'll be happy to help you out if you call us. And I think that's the show for today. See you next week.